Any proof of a keto diet helping with post-concussion symptoms, or would you recommend it following an anti-inflammatory diet instead? Keto diet, for those that don't know, is essentially a high fat-based diet. In and of itself, it can be anti-inflammatory provided you're eating healthy fats and not unhealthy fats. So fats that are higher in omega-3 versus omega-6 arachidonic acids. Tend to be healthier fats. So, plant-based fats tend to be better than, things like bacon and cheeses and things like that. So avocados, fish oils and fish tend to be better than things like, beef that's not necessarily grass-fed. However, grass-fed beef can have high omega-3 concentrations and is generally more on the anti-inflammatory spectrum. So it really depends if you're going to be eating meat, what type of meat you're eating. But that being said, in terms of the diets, keto versus anti-inflammatory, keto, because of its high fat content, the brain tends to like fats as fuels. And that was the idea behind the ketogenic diet. Also, things that are more carbohydrate based can be more inflammatory. And so that again is a kind of a checkpoint for the keto diet. In terms of research and studies that have been done on the keto diet, there's only been a handful of mice studies. There hasn't been too much in terms of ketogenic diet studies done on humans. In fact, I haven't seen a single study done looking at concussion patients on ketogenic diet. The studies that have been done in animals, in the mice, comparing them on a ketogenic diet versus just a traditional mouse chow diet following concussion, finds that the ketogenic diet is beneficial. Recovery rates are better, inflammatory markers are down, cognitive functions are up. So it seems like there is promise for the ketogenic diet for concussion patients specifically, but there isn't enough evidence yet to say that you should be doing one or the other. We typically follow more of a anti-inflammatory type diet or low inflammatory diet, which is essentially avoiding things like refined sugars, avoiding processed meats and foods, trying to eat more fruits and vegetables and more high quality meats. So your grass-fed beefs, your wild-caught salmons, those type of things that generally have less hormones and antibiotic use. Because those are more healthy in terms of just lowering your inflammatory profile down. And one of the reasons that we stick to that more so than keto is that keto is actually quite difficult to do, and not everyone is going to respond well to a ketogenic diet. Generally, it's a lot easier and more balanced of an approach to take just kind of a low inflammatory diet. And it's not necessarily the anti-inflammatory diet, although that's what it's typically called. It's just avoiding the really pro-inflammatory things, right? Because concussion causes inflammation within the brain. You're also going to get a whiplash and other soft tissue injuries that can occur at the same time that are also, they cause inflammation, but they also cause a number of the same symptoms as concussion. And so when you're, eating foods that contribute to increasing inflammation, foods that are high in omega-6 and processed stuff and refined sugars, that can promote more inflammation, which keeps your symptoms there and can actually exacerbate and make your symptoms worse. A way to kind of explain this as well is I have asthma. I have exercise-induced asthma. I've had it my whole life. But once I switched my diet and started eating healthier and not eating sugars and not eating gluten and things like that, I don't need my inhaler anymore, right? So, but when I eat those foods, if I eat something with sugar in it, almost right away I start to wheeze. So it's a very quick, it just increases my inflammation, and my inflammation is felt in my lungs. People with a concussion, their inflammation is brain-based, could be in their neck or otherwise. When they eat these foods, it just promotes that inflammatory response, and therefore they get these increased symptoms. Well, if that's you and you're continuously eating this stuff, you're potentially just delaying your recovery or promoting increased symptoms on an ongoing basis. So kind of a roundabout answer, but basically the way that I would say for most patients, we don't recommend going strict keto because there isn't enough evidence to support it yet. We typically just have them avoid foods that are, tend to be more pro-inflammatory. So refined sugars, gluten and dairy can be pro-inflammatory for a lot of people. So we have them just avoid those foods, try to eat healthy plants, veggies, and high quality meats, and people tend to do very well on that. And this isn't a long-term thing. This isn't something you do for life. This is something you do for a few weeks to see how you respond. So sometimes we get challenged on people saying, you know how hard it is to do this, and what about vitamin deficiencies and that type of stuff. Well, the risks of that are very low because you're only doing this for a period of a few weeks just to see how it affects you, because then you can start reintroducing things back into your diet and seeing if that then brings back some of your symptoms. And if so, maybe those particular foods need to be avoided more long term, and that's something you might need to have some additional counseling on, maybe something you shouldn't be doing just kind of on your own.